3. All right, another non-invasive procedure here is alt therapy. Dr. Sean McGuire has rejoined us. Okay, the basics, 101 alt therapy.
Yeah, this is a really exciting topic for me because it's a unique treatment. It is a non-surgical, non-invasive treatment for skin tightening of the face and neck, but it's unique in that it uses ultrasound. So when we think about ultrasound, typically we think about ultrasound pictures. So when we're doing ultrasounds for pregnant women and for other purposes, but ultrasound is an energy that can be used to create images, or it can be used therapeutically. So this is a therapeutic ultrasound, a high frequency or high intensity focused ultrasound that's used to create heat in the deeper tissues of the face that creates skin tightening and lift. And the neat thing about this treatment is it not only is a therapeutic treatment, but it's also a visual treatment. Again, I'm a very visual person, and so with this technology, we're actually looking specifically at the depth, the specific layer that we want to target, which is shown here in this ultrasound. And ultrasounds are difficult to read even for me, but this makes it pretty easy. We're able to target a specific layer of the tissue so that we can focus this energy directly into the area that we want to create some thermal damage. It's a controlled thermal injury to create some skin tightening. So it's not guesswork. We're actually able to see specifically what we're doing and the specific layer that we're treating.
I don't want to interrupt the alt therapy session, but what is she feeling exactly?
So it can feel like a little bit of electricity or electrical kind of static almost. Sometimes it can feel a little bit sharper than that, and a couple of little zingers here and there. Sometimes it's not terribly uncomfortable, but you can feel a little tingling. And the treatment itself, we can treat the entire face, we can treat the neck, or we can treat portions thereof. So we do everything from the upper face. We can do a brow lift with this treatment, which is really neat, and it's a sort of a long-term treatment to lift the brow. We can treat the entire face, the lower face, the neck, or all of the above. And so depending on what the issues are, there's lots of people that I see that are interested in tightening, want some lift of their face and neck, but they're really not interested in surgery, and they really don't need surgery yet. Maybe they're a bit younger, they don't have a lot of laxity, but have a little bit of looseness and a little bit of laxity of their neck, for example. This is sometimes a good option for those people.
So what kind of downtime are we looking at here, Dr. McGuire?
There's really no downtime. I mean, the treatment itself takes between an hour and 2 hours. It's a pretty it's a very straightforward procedure, but it takes time to do this. We do it here in the office. There is no downtime per se. Person can go back to their usual activities later that day. They may experience some soreness. Sometimes a little bit of light bruising on the surface of the skin, but oftentimes none, and really no signs that the person's really done anything. So for all intents and purposes, there's really no downtime.
So Dr. McGuire, who are the best candidates for this procedure of alt therapy?
Well, again, it's one of those situations I like to look at everybody to make sure that they're a good candidate. But generally, someone that's a bit younger, that just is starting to see some laxity or looseness of the neck and face, some descent or lowering of the soft tissues of their face, maybe the appearance of a little bit of jowls, but just has not to the extent that they need surgery. So in general, these are younger patients that we're seeing, but we have lots of patients that are in their middle ages that do quite well with it. It really just depends on the amount of looseness and amount of excess skin.
All right. If you have any questions, we're putting up the information now on the screen, the alt therapy event. Now, these events, Doc, I'm curious, people can ask questions. Can they see if they're good candidates there, maybe get a little bit of a consultation?
Yep, all the above. So we'll talk about the treatment, we'll demonstrate the treatment, and we'll have a lot more time to talk about what's involved in the treatment, and I can do consultations and determine if they're a good candidate or not.
All righty. Once again, this is all therapy that we're seeing here. We're in the procedure room. And coming back, we're going to look at some procedures, before and after pictures. We're going to talk about some plastic surgery. In the neck area, correct, Doc?
Yeah, I think we're going to be looking at liposuction of the neck.
Liposuction of the neck. That will be next. We're coming to you from the Physicians Center for Beauty in the procedure room. This is where the magic happens on Wave 3 Listens Live.